As several stakeholders battle to find solutions to the COVID-19 pandemic, a Cape Town professor says an alignment of academics and policymakers and implementers in government is crucial. He says this will enable everyone to track the spread of coronavirus much more efficiently. His organization has recently been awarded 14 million rand from the Bill and Melinda Gates Foundation to develop an open source community-supported ecosystem for bioinformatics in public health. Professor Alan Christoffels joins me now from Cape Town. Professor Alan, good evening and thank you so much for your time. Firstly, when we talk biogenetics, what exactly does that include?
I think so. I think that the phrase probably more accurately bioinformatics. And what that really is, it is bringing together two fields, namely biology or genetics on the one end, and then computer science and the analytical IT systems. And so it is trying to merge the analysis of biological information, but using IT systems.
It's interesting because one of the things that you've said is that in doing this, you're also bringing together two different fields where you have information that exists in academia and sits in academia and simply is not available in public health centers where it's needed the most.
Yes, I think probably what I need to do is explain that very often in the research environment, you would be funded to do a particular project. There'd be a defined period for that. And very often the outcome or the end product would be some measure of trying to publish that work. But when we are dealing with health interventions, what we really need is to be able to take the technological advances which we develop at universities and really make them fit for purpose so they can go into the public health space. And to do that, you really need to invest both time, money, and also resources into making sure that those interventions can be accredited, particularly when you're dealing with clinical spectrum.
So when it comes to COVID-19, perhaps just give us a practical scenario or example of how what you're now working on would be used by those in the health sector.
Yeah, so I think if we look at public health laboratories, if we go to a hospital and we go for some form of examination, we'd see that the doctor would request some other tests to be done. And those tests, they might draw blood and send it away. And there are public health laboratories that are then the go-to places to have those tests done, which means that they have been accredited. And what we are saying is that in addition to the routine laboratory diagnostics, we see a space for these laboratories to exploit genetic material from bacteria and viruses. In the case of COVID-19, we see there is a space for these laboratories to utilize analytical methods to analyze the genetic information of the virus that is isolated from a COVID-19 patient. And so in our project, sorry to interrupt you there,
Sure.
but so in our project, what we are doing as a global collaboration is to say, can we take the IT methods that we have developed and then empower the public health labs so that they can rapidly make sense of the genetic information for this virus. And you're not only doing it in one country, because ideally you're wanting to be able to share the genetic profiles of these viruses in South Africa with its neighboring countries and possibly more broader globally.
What will be the outcome of using then this technology? Does it automatically mean that perhaps the period, the waiting period for testing will be shortened? What is the benefit of using this technology?
So the benefit would be, remember when we are doing testing, we are testing if somebody is positive or not. what we are saying with the use of or the access to a understanding of the genetic fingerprint of this virus, we could then track or trace that virus from one individual to another, which means that we can start to monitor the spread of the transmission of this disease from one place to another. We can then also start to understand whether or not this virus is changing more rapidly or less so in certain areas. And so you start to be able to do surveillance of the virus itself.
It sounds like it's going to be quite a big collaborative effort, especially when you look at not just the countries that you'll be working with, but also the scientists and the public health practitioners. And interestingly enough, in South Africa right now, we're witnessing this debate publicly of different specialists and epidemiologists who are weighing in on how government should be responding to COVID-19, how the lockdown restrictions should be eased or shouldn't be eased, depending on which side of the spectrum of the debate you're coming from. So with this huge number of experts, how much longer will it take to reach consensus on certain issues, given the fact that everybody, of course, would put legitimate reasons on the table?
I think also what you've got to remember is that as part of a coordinated response, what what we are saying is that we are adding another dimension to trying to make sense of things. And so we are saying, can we empower public health laboratories to add another component to the arsenal in trying to make sense of how this virus is spreading? It is one component which we feel is not necessarily available globally. There are certainly countries that are utilizing it more than others. And I think that is just because of the availability of both resources as well as workforce. And so we feel that this would be another dimension that we can add to help trying to understand how the virus is spreading. And I think it's something that would be a collective decision, because you are not going to be building these systems necessarily straight away, but you do want to get public health officials as well as academics in the same room or around the same forum so that they can essentially define what the agenda needs to be so that we can start to tackle. For now, it's COVID-19, but keep in mind that we are living with a range of infectious disease burdens, including TB as well.